start right away. Thank you very much. Guys, if you see me on the Facebook Live, please, guys, let me know so we can start. Okay. Okay, guys, please, guys, if you see me online on the Facebook, please, guys, let me know. Thank you very much. By the way, today we have very important topic for part 1 and part 2 champions. And this topic, it has a lot of confusion about it, and lots of debates about it. Should we or we shouldn't? That's why I prefer to discuss this topic. Guys, do you think, guys, what can be the topic about? By the way, guys, before I start, I would love to check on every one of you. Please, guys, how you doing? Please, guys, tell me how you doing. Okay, that is great then. Let me, guys, check on you on the Facebook first, so we can start right away. This is home. And I believe this is on Facebook right now. Please, guys, if you can't see me live on the Facebook, please let me know. I see Dr. Parsi there on the Facebook and he says hi. Hi, Dr. Parsi, how you going? Yes, we are live. That is very good then. Hi, Dr. Shama, how you going? That's great. Then let me, guys, share my screen so we can enjoy the session tonight. The screen, let me share it. Please admit if you can admit everyone on Zoom, that would be great then. Okay, guys, now I see you on the Facebook. I'm very happy, guys, seeing you. Exam is soon, I know this. So everyone should put effort right now, guys. Please, guys, ensure you put the right effort. Now, hi, Dr. Parse, how you going? Dr. Shama, Dr. Kur, Dr. Monisha, Dr. Kanika. Antibiotic therapy? Not a topic. Hi, Dr. Liv, how you going? I'm very happy, Dr. Liv, to hear that you're doing great. I'm doing great too. Thank you very much, Dr. Liv. I really appreciate you asking about me. Thank you very much. Thank you very much, Dr. Shiva, because you asked about me too. I hope you're doing great too. Hi, Dr. Natalie. Hi, Dr. Taslim. How are you going, Dr. Taslim? Thank you, Dr. Banu. I like your name, Dr. Banu Ray. Hi, Dr. Saida. How are you going? Hi, Dr. Maria. How are you going? And everyone on the everyone on Zoom as well. Okay, guys. Now, today we gotta discuss one, as I said before, a very important topic for ADC, either part one and part two. You definitely, guys, need to read and study this topic because one of the basic topic as a general dentist, you really need to know about them. By the way, guys, did you get the bidobites and diamonds? Yes? No? Hi, Dr. Murray, how are you going? Dr. Devench, how are you going? Okay, guys, I understand there's a little bit of delay. Paper 2, yes? Okay, I'm very happy. You got them, doctor? Okay, guys, I hope, guys, you enjoy them. I hope you enjoy them. Hi, daughter. Sandra, how are you going? Okay. So now, the normal question every Tuesday. What do you think is the topic? Let's see, guys. Try your luck and tell me. It's an important topic. Very important topic. It can be an exam. Hi, Dr. Gagan. How are you going? Dr. Gagan Deep. By the way, guys, maybe this session will not be recorded, okay? Perio, not perio, no. Guys, I will give you $5, but you need to meet me personally to give it to you. If you can expect what is the topic for today. Medical emergency? Not really. Trauma? Not really. Okay, guys, seems like you don't know. I can be, right? Please, guys, if you are actually type in there on Zoom, please, guys, type only here. Or a surgery topic? No, it's basic, so either pain. Oh my God, Dr. Parsi, I got it. Fluoride what? Fluoride related, very smart. He just said fluoride related. Pain management. And if up to 90% of dental issues or dental topics actually either gonna be pain management or fluoride related. But you're very close. Actually, you mentioned somehow. Not emergency. Bad colleague? No, really. Dental care damage, bleaching, cracked tooth syndrome? Not really. Pub vitality? Oh. Everyone, guys, gonna give Dr. Need a big heart. Fluorosis. Fluorosis, bleaching. You're very close, Dr. Hussein, which is more incisor. Hypomineralization is very close, Dr. Hussein as well. Big heart to you. Because yes, fluorosis considered as more incisor hypomineralization as well. Good colleague. There is no good colleague, Dr. Lev. I'm just kidding. This incising agent. Okay. You got $2? Yes. You got $1 or no two, Dr. Parsi. Okay, guys. This is the case. Let me share it with you. Who's guys gonna be happy to role play? Let me just share it with you. Okay, guys, why would I do this session? This session, actually, it is one of the most important session. Why? Because the candidates, most of the time, they just read and study. And once we give them a role play, or once we give them a scenario with questions, they stuck to be able to apply whatever they have read nicely into a scenario. That's why I was thinking, how can I help you guys to understand how to apply the concepts you actually read from books or you study into the clinic? So in this case, we need two skills. The first skill is the clinical judgment, and the second skill is the critical thinking. That's why every Tuesday we do the session, so we all together are going to be more like an open discussion. We all dentists, we have meeting all together, and then we discuss about a case, and then every one of us going to say his point of view, how to manage this case. And this is the benefit of Tuesday session. Every Tuesday we do the same thing. Okay. So now I'm sharing the session. I'm sharing the PowerPoint with you. How much you guys will find this session beneficial? How beneficial is this session for you guys? View, insert, view, read in view. Okay, share the screen. Let me check how beneficial the session. 100% beneficial. I'm very happy. Very much. I'm very happy. Dr. Live 100%. I'm very happy, guys, to see this. This is motivation to go more with this type of classes. And then I feel happy as long as I can help you guys with something. Okay. Who's guys willing to do role play? Let me check this on Zoom. Please, guys, be on Zoom and raise your hand, or you can tell me. So, guys, this session more as a discussion between me and you, as a general discussion. We all together are dentists. Okay. Let's mute this first. Now, muted. Let me ensure this one is. I don't think at all we have echo. Guys, do I have an echo? I don't think so, right? Okay, let's start right now with the case. Let me check who has raised the hand and would like to do a case today. Either here because I remember. Okay. Let me get the Facebook. Dr. Melsman would like to do a replay. And here on Zoom, I can see Dr. Ampish and Dr. Ampish as well. Would do a replay. Dr. Amna, I remember as well. Okay, let me get. And Dr. Angel Joy. Okay. Please, guys, talk to me. Dr. Angel Joy, talk to me. Dr. Amna, Dr. Ambish, so we can, guys, check one.
Hi, Doctor. Hi, Dr. Bido.
Hello, Dr.
Hi,
Liva.
Doctor. How are you going, Dr. Amna and Dr. Ambish?
I'm good, Doctor. How are you doing?
Good, thanks, Doctor. Thanks very much. Let me check here as well, Dr. Angel, because she raised her hand.
Yes,
And
yes, doctor. I was on mute.
no problem, Dr. Angelo. Good then. Guys, there is any echo, guys, at all?
Not really.
No, really? That's okay then. As long as not really. Okay. This today's case is actually somehow interesting case, and you know, guys, as well, it's a little bit confusing. It has lots of clinical judgment points. Need to discuss about them today. Am I right about this?
Yes.
Okay, very good then. Okay, I'm happy with any one of you to do the role play. My suggestion always, if someone has exams soon, that's one. Number two, if someone I promised earlier that they go into the role play. So, guys, did I promise any one of you that you go into a role play today, or
Me,
do you have
doctor.
exams soon?
Me.
Anyway,
You told me that I'll be doing a role play this time, Tuesday.
okay. So it means like I promised you, Doctor Ampersand.
But if Dr. Amna has an exam, she can go ahead. I don't mind.
I'm happy with any. I'm happy with both of you guys. I'm happy
I
with Doctor
don't
Angela as well.
actually.
Dr.
Um,
Angel,
I
yeah.
have to book my date soon, but just that I'm happy with Dr. Ambesh. Just one thing, Dr. Biro, I always get confused with the consent thing in this case. So if you could elaborate on that during the role
Yes,
play.
yes. We will discuss this one.
Yeah, just that.
Yeah, and
Thank you.
you still, if you have any question, we still can discuss the questions here as well. Okay,
Yeah, perfect.
no problem. Doctor Angel, would you like to do it, or Doctor Ambush?
let
Um,
him do it because as you promised him last week, so let him do it. He also has his exam. Can I do it
okay,
next
no,
Tuesday?
okay. Well, definitely, I'm
Oh,
happy with
I'm
this.
I'm
No
in
problem.
period two. I'm in period
Okay.
two. So if you have an exam before me, you go ahead. I don't mind.
Oh, okay. Then I can do it. No problem.
Okay.
Okay,
Okay. Go on. Good luck.
okay. Thank you
Thank
very
you.
much. Thank you, Doctor Am, everyone. Okay, Doctor Am, that's a great. Then, do you want to see the replay? Sorry, do you want to see the case? Right.
Yes.
Let's enjoy the case together. It's very interesting type of case. It will
Okay.
have lots of, like I would say, a little bit of um, tricky points in them, but they are tricky, but still very interesting. Okay,
Okay.
okay, that's the case right now. I will definitely add more information when you ask me. So I'm waiting for you to ask me. Okay.
Okay.
Yes. Now, because I don't put all information in the scenario, I want you to
Mm-hmm.
ask me good questions. I want to ensure
Mm-hmm.
you listen to me because in between, I will be giving you more information. So I need to know that you have good listening skills as well. Okay?
Okay.
Okay. Can you see the case right now?
Yes.
Okay. Can you please read the case loudly for me?
Sure. A
Thank you.
14-year-old male student attends your practice because he's unhappy with the color of his upper front teeth, 1 1 and 2 1, and would like them fixed today. He
Yep.
reports no pain or sensitivity. Clinical examination shows 1 1 and 2 1 are not tender to percussion, no swelling is present, and soft tissues are healthy. You have just completed a scale and clean. The teeth appears discolored with no obvious caries or fracture.
Right.
Diagnose the condition, explain your clinical findings to the patient, and obtain informed consent for a suitable treatment plan, including what can be done today and answer the patient concern.
Very good then. Looking at the tooth, look, I made it a little bit hard, okay? So it can suit
Yeah.
everyone. Looking at the tooth right now, what do you think is the diagnosis?
To be honest, I see whitish discoloration. It could be fluorosis.
Very good. How to
Yeah.
confirm is it fluorosis or not?
I have to ask if he was taking any, I mean, where he's coming from, if he had any fluoride tablets when he was really young, or if he had a habit of tasting the toothpaste, or, yeah,
Okay.
the fluoride ingestion
Very
history.
good. The word is this is what I want. Fluoride, excessive,
Ingestion.
excessive
Mhm.
fluoride ingestion, right?
Yeah.
So it means the
Mhm.
child has ingested an excess or consumed an excess of fluoride, which it shouldn't be. At which
Yeah.
age do you think this should has happened?
Since it's Permanent molars, so below at the age around 1 to 3 years of age. Permanent
Yes.
incisors, sorry. Yeah. Yeah.
Okay. If I want to
Yeah.
give you only a range, if I
Mhm.
want you give me only one range. So what
Mhm.
is the only one range of year you can give me? Which age? Like, is it from which year to which year?
1 to 3.
Very good. 1 to 3. I'm happy with this.
Mhm.
Okay. That could be one
Yeah.
to three. It can be until maybe sometimes, but for incisors, I don't think like more than three will be too much, right? 1 to 3. Okay.
Yeah.
I'm happy with this. Now, do you have any question before we start this case?
Mm, no, let's see how it
No?
goes.
Okay. How you feel about it? Are you confident about it or not?
No, to be honest, doctor, I never thought that you would pick me. I thought there would be so many people. I was just trying my luck, and
I'm happy
I.
then. Look, it will not be hard case, right? And I'm
Okay.
very
Yeah.
happy that you take the lead right now. And
Hmm.
you brave enough, right, to do the role
Yeah.
play. And this
Yeah.
is actually shows how strong you are. There are some candidates that they hide in now, right? They only listen to you. They don't want to do it
Mhm.
because they're scared to do it. But the
Mhm.
benefit of this role play is you actually show up. You prove to yourself you are strong. You can do it. Okay.
Okay.
And we're gonna learn. By the way, we're gonna learn a lot from this role play or this case.
Yes.
Okay. Now, don't be the. I tell you something. The most
Yeah.
important thing that to build up your confidence
Hmm.
is to believe in yourself and don't try to memorize anything. Don't try to remember anything. Just be open. Say whatever you know. You don't need to be wow. Don't think about anyone in this world. Don't think about me. I'm listening to you. Don't even think how good you're gonna be. Don't think, is anyone gonna judge me or not? All of this is just only fake, I would say. There's all fake thoughts inside your mind, inside your head.
Hmm.
If you just try to think like, you know what, consider me like your eldest brother, for example. Okay?
Yes.
Consider me more into a friend. We are two friends right now. We just talk about something. You
Mhm.
know better information than me. I know nothing about this case. You try to help me. That's it.
Yeah.
Be yourself.
Okay.
Don't need to memorize anything. Don't need to say something wow. You don't need to impress me. Just make it
Hmm.
easy as much as you can. Say the words that you know that you can say. You don't need actually like even if you say jargon once, that's okay. Even jargon twice, that's okay.
Hmm.
Okay?
Okay.
But the most important thing is trust yourself, be open, try to make it easy conversation between me and you, and that's it. No more than this. And by the way, we're gonna discuss the whole case at the end. Okay, so don't worry.
Yeah. Yeah.
No worries. And if you want my biggest suggestion ever is
Yeah.
just follow the bold part. You see this bold part?
Yes.
I need you to explain your findings, whatever findings you see here, and then diagnose the condition. Tell me this is what we call it, and then
Hmm.
somehow try to talk to me the way that finally you can tell me what are the treatments for this condition. By the way, tell me just to make it easy from the beginning somehow.
Hmm. Hmm.
What is your diagnosis in this case?
It's most likely fluorosis.
Yeah, very good. We
Yeah.
have, I would say, four classifications for fluorosis.
Hmm.
Apart from to be localized or generalized, but based
Hmm.
on the severity, we have minimal, like very minimal, and we
Hmm.
have mild, and then moderate, and then severe, or sometimes we call it very severe. Okay? If you want to
Hmm.
say, sometimes we say minimal, then mild, then moderate, then severe. They are four. Or
Hmm.
sometimes we call it mild, moderate, severe, and very severe. So this
Hmm.
is one. It just somehow between minimum to moderate, so to mild.
Yes.
Do you agree on
Yeah.
this?
Minimum. Yes.
How do you know? Because let's say I like the way as well we think about, because guys, we have been trained very well in part one how to choose the right answers from MCQs. So sometimes I like actually to change the information being communication to MCQs. So now, if you have an MCQs about the diagnosis of this case, which one you gonna choose? Is it mild or moderate or severe or very severe?
Mild.
How did you know it's mild?
The moderate would have mottled appearance as well, maybe pits
Good.
and brown stains as well.
I agree. And
This appears very superficial,
very good. I agree. What else?
and
Since
it's just affecting the
look at
incisors,
this.
maybe.
Look at this word. He reports no pain or sensitivity. What does it mean? Enamel is intact.
Yeah,
In mild cases, enamel is intact. In
yeah,
moderate, it can be a little bit mild sensitivity. Severe will have pain. Did you get my point?
yeah.
So how do you know? Is it only from the appearance? As I said, is it modeled only a little bit like a mild changes? Yes. What
Mm,
else? Sensitivity. Not sensitive
mm,
means it's just a
yeah,
little bit of discoloration without breaking down of enamel.
mm,
If it's just a little bit of opacities, we call it opacities, right?
yeah.
If a little bit of opacities around without without damaging enamel, so in this case will be mostly mild, not moderate or severe. Very good. This
Mhm.
is very good now. What is the treatment for mild type of fluorosis?
Um,
Give me, sorry for
micro.
this. Give me whatever you
Mm,
want. Give me anything
uh,
you know. You don't need to be in order. You don't need to be anything. Just tell me, we discuss. Tell me this and this and that.
Okay. So I would give a treatment option of no treatment because he doesn't have any sensitivity, no pain, and it's just purely aesthetic, and he's just 14 years old. So even if he doesn't get any treatment, that's fine too. But if he wants the treatment, then we can give resin infiltration.
Okay. Very good.
One, second, microabrasion. If it is very superficial, although microabrasion is mostly given in cases where there is stain, it is not stained, so I'm not sure. I would go with resin infiltration only.
Okay. Only resin filtration, right?
Yeah, yeah,
Okay. I would agree on this. But now, you mentioned
mm,
something to me right now, and we just discussed right now together, right?
yeah,
You mentioned to me that cases of microabrasion, you should have
mm,
stains. Am I right?
mm, yes,
Okay. What
mm,
sort of stains? It means like darker stains or white stains.
darker stains.
Okay. Can I tell you something, please?
Yes,
Not necessary to be darker stains.
okay,
It's just opacities. One
okay.
conservative type of treatment because you only can remove about zero point 0.1 to
Mm,
zero point 0.2 of the superficial opacities, enamel opacities.
mhm,
So it's used in case when there is opacities. Not necessary all the time to be stained. Opacities. The word being used is opacities.
mm,
Okay?
okay, okay.
Okay. So in this case can be a good option here right now because what I see just opacities, yes, it can be.
Mhm,
Okay?
okay.
Okay, let me just do something, please. Yep. Okay, very good then. So what else? I'm very happy with microabrasion.
Mm.
I'm very happy also with resin filtration. What else do you think?
Um, composite masking.
But he's too young, right? And then this is
Yeah,
just a mild.
yeah.
Yes, it can
So,
be in severe cases maybe, but
yeah.
I give you good hint when you should
Mhm,
choose composite restoration as composite masking or not. Even resin filtration, okay? We
mm,
normally use resin filtration when there is enamel loss. What sort of enamel loss can be? When the enamel loss is happening, right? It can be for this case. Let me just get another case for you.
okay.
I will tell you right now. Okay, In pitting, when you have pitting, do you think there is enamel is it smooth or just a little bit lost in between? When you have a little,
Enamel is lost.
very
Yeah.
good. So now, if I want to make it smooth, I will use in this case resin filtration to make it smooth.
Mm-hmm.
Did you get my point?
Yes.
So we use resin filtration as a camouflage. We camouflage things around. Mostly, when you have a little bit of enamel removed from
Mm-hmm.
there, lost from there. Same exactly with composite veneer, right?
Mm-hmm.
Composite laminate veneer. What does it mean?
Yeah.
When I have moderate cases, when the enamel has been lost, and now I can use composite. But in this case, it's just mild. So no
Yeah.
need. Okay?
Yes.
It's a mild test, no need. Okay,
Yeah.
very good. What else do you think? What are the things you believe? Guys, please guys write and comment on Facebook because this is gonna help everyone here to understand. What else, please?
Mm. Since he's just 14, I wouldn't recommend bleaching.
Okay, very good point. Guys, are you with or against bleaching, guys? Everyone here, guys, on the Facebook, please let me know. Are you with or against? And please give me a proper reference. We have a discussion about this point. Let me check here. Everyone says that you're doing great on the Facebook. And then I see here it's a mindful roses, yes. Until 6 years, okay. 0 to 1, yes, I agree. 0 to 3, 0 to 1, I agree. 0 to 1, be more specific. Bleaching, yes, you are with or against the guys bleaching. If above 15-year-old, okay. Bleaching, yes, against guys with bleaching, okay, with bleaching. In 14, no bleaching, okay. Bleaching, no bleaching. Against bleaching, no bleaching. I'm against bleaching. In this case, I don't recommend the bleaching, but generally bleaching is okay. No bleaching. No under 16, bleaching after 16. Bleaching over 16, against. No bleaching. Okay, no bleaching. Okay, guys. So what we're going to do right now, let me guys share the screen. This is one of the points which is really, really, guys, you need to understand about. Okay, guys. Can you see my screen right now? Doctor, can you see my screen as well? Are you? Yeah, I think you can see from Zoom as well. Am I right, Dr. Angel? I think Dr. Angel is on mute. Okay, let me just do something here right now. I will make you co-host so no one can put you down anymore. Can you hear me now, Dr. Angel?
Yes, doctor. Thank
Okay,
you.
no problem.
Yeah.
Can you see my screen right now?
Yes, yes.
Very good. Guys, this is the latest version, 2023, 2024, as we mentioned here. Okay? And
Mhm.
this is actually coming from AAPD, which is Academy of Pediatric Dentistry in America, American Academy of Pediatric Dentistry. So, is it something can we rely on it? Yes, because in Australia we actually get our information or some of the information from these guidelines. Okay, guys, everyone, guys, agree on this in the beginning?
Yes, doctor.
Let me check on the Facebook as well because everyone should be aware about what we discussed. Now, guys, I'm not going to give you my opinion. We just only guys gonna write we only gonna read this article and based this article, we all can decide together. I am a candidate like you right now. I'm not teaching right now, okay? When there is a confusion, I put myself as a candidate in the first instance because I like to think like you. Now, let's go ahead with this article. The article about what? It's about the use of dental bleaching for child and adolescent patients, not for kids. Dr. Angel, is that clear enough to you?
Yes.
Okay. Let's see now what they say, what they have said. The policy, that's okay. They have their own style, that's okay. Due to the difference in the thickness of enamel of primary and permanent teeth, tooth coloration within the dental arch may vary during the mixed dentation. That's fine. Full arch cosmetic bleaching, full arch cosmetic during this developmental stage, like mixed dentation, however, would result in mismatched dental appearance while the child is permadentation. Adolescent present with unique dental needs and the impact of tooth discoloration on the adolescent self-image variable. Tooth whitening has been successful in adolescent patient using typical bleaching agent. What does it mean, typical bleaching agent, doctor? Means we use hydrogen peroxide,
Mm.
right? Which
Yeah.
is either from 25% as Philips product up to maybe 37,
37%.
yes, percent, even 41% as
Mm.
the Australian products here we use as well. Okay. So they
Mm.
say adolescents. What does it mean, adolescents? Early adolescents start from 10-year-old. Okay, fine. Dental whitening may be accomplished by using dentist directed modalities. The strengths, you see, prescription strength products for in office or at home use. Now they said for adolescents, they can be used both home and office. The home, it has a little bit percentage in it, maybe 10%, but in office, we actually like to use from 25 and above. Over the
Mm.
counter bleaching products for self application or non dentist directed. Okay. Treatment under dental professional guidance over several advantage. This and this and this. Okay, good, good, good. Let's see now to be more specific in area. Custom tray ensure intimate fit and fewer adverse gingival effects. Over the counter, commercial. Yes, we don't prefer that much. However, the lack of customization and supervision may result in increased side effects. Maybe at home will not be that
Mm.
much as good as in office. Very
Yeah.
good. This is peroxide containing whitener, bleaching agents. 10% carbamide that can be at home. Peroxide that can be at home, 5%, 13%, 13, 20%, 35%, until even sometimes 41%. Now, what's the decision right now? Permanent teeth with intrinsic, permanent, okay? Doesn't mention how old is the patient. Permanent teeth with intrinsic discoloration, fluorosis, hypomineralization present as difficult essay challenge technique involve a breakdown of outer enamel. So in this case, we can use microabrasion. Enamel theft using acid etchant pumice, which is microabrasion. So now one of modalities is microabrasion, followed by subsequent remineralization with sodium fluoride or casein. That's actually for sensitivity.
Mm.
Additional technique is to use sodium hypochlorite bleach sealing. Sealing now we talk about resin filtration, like here right now. More recently, unfilled resin filtration can be used as well, right? With and without the use of bleaching agent, with significant improvement. So now, the basic treatment, and guy is I think now it's more clear to you right now based on this article. The basic treatment in these cases is microabrasion, then
Followed by.
very good. Or resin infiltration, unfilled, with or without whitening, bleaching. Sometimes
Mm.
we need, sometimes not, based on the severity, right? Now,
Mm.
side effects from bleaching can be definitely vital, non-vital, or ever teeth. Very good. Now, hydrogen peroxide is highly reactive substance. Very good. Contraindication for extended period of time. Very good.
Mm.
Now, Look at this part right now. Back, going down, 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 down. Good. By the way, guys, that's the best way to read the articles. Now, the policy statement. Now, this is the policy statement. What's supposed to mention? The AAPD supports procedures that have been shown to be safe and effective for whitening, discolored for whitening, discolored teeth for children and adolescents. Although the use of whitening agent can improve dental aesthetic and enhance person's self-esteem, AAPT advocate dental bleaching be incorporated into individualized, comprehensive, and sequenced treatment plan in accordance with safety and efficacy standard defined by clinical research and best practice. Now, what do you think about the policy right now? Over-the-counter dentists, wherever home, used additional researches. Now, for adult, do you think full arch not used for dental bleaching products during pregnancy? Not. We don't want to use them during pregnancy. We shouldn't use them in mixed dentation or primary dentation. We still discourage this, but for permanent, even adolescents, guys, what do you think right now after reading this? Can you do whitening for 14-year-old or not? Let me check. What do you think, Dr. Now? Dr. Angel?
Yeah. Here they say they can do, but it is not, it is discouraged because of the side effects.
That's for primary, right? For
Okay,
primary
the mixed dentition.
and mixed dentation. But 14-year-old, there's no mixed dentation.
Yes, but they also mention about the side effects that it can affect the vitality of the tooth. And we have to be really careful with the
Yes. So let's read this
bleaching.
part again. The AAPD supports procedures that have been shown to be safe and effective for whitening, discolored teeth of children and adolescents. Although the use of whitening agent can improve dental aesthetic and enhance reason for self-esteem. Advocate dental bleaching as incorporated into individualized, comprehensive, and subsequent treatment plan with safety and efficacy. So, guys, now I will leave this for you right now. Okay, you can read this, guys, in details, word by word, and then based on this, you can tell me, can you really do whitening in adolescents, including like 14-year-old, or not? Let me check what the people say on the Facebook. Not for mixed dentation, not for first choice. We can do it, but not very suggestive. Yes, with caution. Yes, yes. Okay. Now, based on your satisfaction, that's the one you need to apply.
Hmm.
Okay, based on what, but you need to convince me. Okay?
Okay.
Okay. Tooth whitening has been successful. Look at this. Tooth whitening has been successful in adolescents patients. Adolescent means like 10-year-old until 18. Okay?
Hmm.
Very good. Okay, okay, okay.
But then it's also written, but research is lacking on the effects of.
That's for these people. That's for this group. Okay, let's just which one? That was this point, right?
No, no, not that one. The one that you just read.
Okay, back again. That's very good point. When you actually we discuss together, tell me please which one. But research is lacking on the effect bleaching of primary,
Oh, okay. Fine.
right? We're talking about
Yep.
the permanent now. We're talking about permanent
Yes.
14
Yes.
year old, 15-year-old. So it's like an adolescent.
Yes.
Okay, yeah, primary, yes, I agree. Primary, yes.
Mm.
And especially full arch. We don't like the full arch.
Mm.
Okay, that is
Yep.
good then. At least now you have good idea about this case, about the point we discussed right now, so we can start. We can
Yes.
start right now. So just to
Yes.
conclude this again, my opinion is that 14-year-old can be done. There is nothing I haven't read anywhere else, except maybe in one website. This is a website for, I believe, was dental hygienist or dental therapist in Australia. It just been like one thing's mentioned 16-year-old or above, or
Mm-hmm.
16-year-old and above. Apart from this, based on these articles, there is nothing has mentioned yes or no. There
Okay.
is nowhere has mentioned direct yes or no. But based on you, if you ask my opinion, the answer is yes. You still can do it with caution if actually required.
Okay.
Okay? Yep.
Mm-hmm.
Okay. Now, let's now get the screen. All the best to you. We still have lots of other points we can discuss together.
Yes.
Okay, very good. Should I give you 2 minutes reading then?
Yes, doctor.
I will give you 3 minutes reading. All the best to you. Then let me just get this one. And then I need to get show meeting. That's fine. From the meeting, I need to get more from more. The best way is just to stop sharing so I can get all the stuff again. The app is here. 3 minutes. Okay, I will set up 3 minutes reading for you. Yep, all the best. I will share now the screen again to you, the case. Yes, all the best to you then. Okay,
Thank you,
guys.
doctor.
Dr. Angel was going to read and prepare her case for 3 minutes time. Thank you.
So there's no name given here. How should I
Um,
address you?
I'm
Because
I am Mark. My name is Mark.
Mark. Okay.
Can call me Mark, yes, please. All the best to you then. 10 seconds.
Okay.
No problem.
Yeah. Yeah. Yes, doctor, we can start.
Just give me a few seconds because we need to start the timer. Now you can start.
Okay. Yeah. All right, Mark. Thank you for being very patient while I was doing your clean and scale. Your teeth looks good and your gums are also fine. But I understand you're worried about this discoloration. So could you tell me a bit more about your worry so that I can help you better?
Hi, doctor. You're totally right, doctor. I'm really frustrated. But before I start, I would love to know your name, doctor. Sorry.
Yeah. Oh, sorry. Call me Angel.
Angel. Okay,
I'll
doctor.
be your guide.
Angel.
Yes.
Look, I just don't like how the front teeth look. It's a kind of
Mm-hmm.
patchy and lighter than the other teeth. They
Okay.
actually not hurt. Just bugs me.
Mm-hmm.
Dad reckons he gave me fluoride pills when I was a child, when I was a kid.
Mm-hmm.
Doctor, I'm not quite sure what is happening, and doctor, I'm here today because I really want to get fixed because I have my celebration happening in school for my success. So there's gonna be a Photoshop and Photoshop, sorry, and then I need to get the teeth fixed nicely.
Okay. So if I get it correct, you had these fluoride pills when you were really young. Could you
Yes,
tell
that's what
me,
my dad told me.
okay, your dad told. Okay. And do you recall since when, till when you had these tablets, these pills?
No, actually, he said when I was a kid.
Okay. Okay. And is this the discoloration present in your front teeth from the start, or is it something recent?
No, I think from start, doctor. I born with these tooth, as I remember.
Okay. And did your baby teeth had any problems, or is it just this two teeth?
I can remember, doctor. Sorry.
Okay, no problem. That's fine. And you mentioned that you have a photo shoot in a while, like in few days.
Yeah, that's going to be about 2 to 3 weeks from today.
3 weeks. Okay. Thank you for this information, Mark. This helps me. So, about these pills, were you in Australia that time, or have you been migrated to Australia?
No, actually, I was in Australia and also migrating outside Australia, overseas as well, both.
Okay, okay. Thank you for this information, Mark. So, based on the
Sorry, doctor.
examination,
Sorry, doctor. Just a question here.
yeah,
Why
yeah,
did
yeah,
you
sure.
ask me if I was reside in Australia or I was traveling overseas?
Oh, I asked this question because sometimes overseas they used to give, like in the past, they used to give these fluoride pills to make our teeth stronger. So
Oh, so
that's the
doctor means
reason.
like you don't provide this pills anymore.
No, we have stopped using that because in Australia we have this tap water which is already monitored and fluoridated. That would do the work, and fluoride pills
Oh,
are no
means
longer
like now
recommended.
my dad has actually damaged my teeth. Oh, he
No,
is
no,
the reason then.
I wouldn't say that, Mark, because as I mentioned earlier, it used to be that fluoride pills can make your teeth stronger, and maybe that's the reason your dad gave them to you to make your teeth stronger. But
I'm still very
unfortunately,
angry and upset on my dad then. He shouldn't do this for me.
oh, I wouldn't say to be, sad and angry because he might have done it for your betterment to make your teeth stronger, actually. And
Uh,
that would have been prescribed by your dentist.
okay,
That's why
doctor,
your dad
doctor.
might.
Okay, so doctor, I'm not quite sure what's going on now. So what is the reason why this has happened?
Yes. So the white discoloration that you see right now is most likely because of a condition we call as fluorosis. That happens when we take fluoride in excess in the growing period and the when the tooth is being developed. And if we take a lot of fluoride that time, that can cause this kind of whitish discoloration. And it is
Hmm.
very mild. Okay. This is actually quite mild, and we need to be really looking at it to see if there is a discoloration.
Okay,
You
but
don't?
no, doctor, I still very conscious about it. Every day I look at my
Yes.
tooth or my teeth at the
Mhm.
mirror, and then I found really I must do treatment for them, doctor. I must get fixed, doctor. Sorry.
Sure, sure, sure. We'll help you with that, Mark. But do you understand why you have this fluorosis now? and what the condition
Yes,
is
you
called?
said because have ingested an excess fluoride when I was a child, right?
Most likely. Or do you recall if you had a habit of eating the toothpaste or something like that?
Eating toothpaste. Not sure.
Mm. Sometimes that can also lead to this condition, but since you mentioned that you had these fluoride tablets, so most likely it is that because of that. But don't worry, we can do something for you today.
Yes,
Okay?
please.
Yes. Now, you understand this condition. Any doubts?
No,
Do
no,
you,
no.
do
It's
you have?
clear now to me, doctor. So, what are you
Okay.
going to do then today?
Yes. So you have few options. One option, which is the most recommended one here, it would be microabrasion, wherein we put a uh, abrasive substance on the teeth, and just like an electric toothbrush, we'll just clean it and it would remove these white discoloration. Okay. We can do that in this sitting, but it would cost you around 100 to $200. All
Doctor,
right.
don't worry about money right now. Okay, that's okay.
Okay.
Yes.
Okay,
But,
that's
yes,
wonderful
doctor.
then.
So, yes, you said micro something. What is again, doctor? Sorry.
Microabrasion,
What's the
wherein we
benefit to do
just
this, doctor?
that would remove the whitest discoloration that we see right now, and it would most likely even out the color. Okay, so you won't
Okay.
be seeing that. Since it is very mild, it should do the work, and the color will become uniform.
So, doctor, can you guarantee this is micro things you have mentioned right now is going to
Ah,
fix my tooth?
that's a really good question. I But the answer would be we cannot guarantee anything. We have to check once we do it, and then we have to see if it is evening out or no. Okay.
Okay.
Hmm.
That's okay then. So, are you going to do this today?
If you give me your consent, like your consent from the parents, we can start it right
Oh
away.
no, the parents is actually living away. You know, they're not with me. They are in the farm there. They look after the cows and then the other animal there.
Oh, okay. Then we can mail them, and if they
They don't
can.
have internet connection, doctor. They don't even use any mail. They are old. They're
Oh,
not like a Gen Z on the people right now. They're really old.
oh, okay, okay. Do you have any guardian here who can give me the
No,
consent?
no.
Okay, Mark. Unfortunately, since you're just 14, it would not be, I'm legally bound here and I won't be able to do any treatment without the consent.
Why, doctor? Like, I understand everything. I understand what you mentioned about this micro thing, like micro abrasion, and this is
Mm-hmm.
going to actually make my teeth looks better. And then
Mm-hmm.
you mentioned as well you're gonna do other things. So I understand everything you mentioned. So why not, doctor? And by the way, I will pay by myself.
Oh, that's really good. In that case, I would like to talk to a senior dentist here. And then if he decides that we can do the treatment for you, I'm happy to do. But
Who's the
unfortunately,
senior doctor? Who is the senior doctor? Like a practice manager, or who's exactly?
the practice manager here. Yes.
Okay, doctor. But doctor,
Okay.
really, I want to very just because, look, I'm very upset for my dad right now. I don't want to talk to him anymore. I'm actually my own. I live on my own. I don't stay with him for the last 3 4 years. I just
Mhm.
I just rely on myself and all my life. So I don't get back to my dad anymore. Because anyway, he has divorced from the mom as well, and then I don't live with any one of them.
Okay. I totally understand why you're feeling upset and why you would be I'm reacting the way you are right now. But unfortunately, legal thing are something that we can't do anything about that because I'm a new dentist here and legally I'm bound. So if anyone below the age of 16, we need a consent. Or if the practice manager thinks that it's fine, we can do the treatment. And if you're the one who is paying, we can look into that. But do you want to listen to the other options that you can have?
Yes, doctor, why not?
Yes. The second one is resin infiltration. That would be a tooth colored material and will the area where the white discoloration is there will fill that area and it would also like the color would match the rest of the tooth. Okay, we'll
Okay.
match the color
Doctor,
and
can
we'll
you do
fill it.
whitening as well? I've heard that you can do whitening as well. Can we do whitening only for these two teeth?
That's a really good question. And yes, we can do whitening, but I wouldn't recommend because you're just 14 and too young for that. And it can also have sensitivity and other problems, not usually present, but it can cause those things as well. And since you mentioned you don't have any sensitivity and pain, I wouldn't recommend going with whitening for very mild discoloration.
Okay, thank you very much, doctor. Time's up. Thank you very much.
Yeah. And I wanted to give no treatment option as well, which I didn't do.
That's okay. That's okay. Did very well.
Mhm.
Thank you very much. Okay,
Thank you, doctor. Yeah.
no
Thank you
problem.
for giving me the opportunity to
No, it's
do.
my pleasure. Definitely. Don't say this. It's my pleasure.
Mm.
Okay, now let's discuss all the things dentally, evidence-based, clinically based, and the plus um, the confidence and all this stuff. Like, I mean, you as I need to personalize things toward you as well. Okay.
Yes, yes.
Okay. One. Um. Now, in the beginning, as in, it's very important because this is just as a start. It's very
Mhm.
important in the beginning to mention your name. You must tell me what's your name.
Okay.
It's good actually to tell me what's your name. Look, they may give marks on it, they may not, but it's important because I need to talk to you too. I need even to call you. I
Mhm.
don't just say doctor. Even if it's diagnosis management or treatment planning, it's better to say, okay, this is my name. Okay, just at any
Mhm.
time if you want to call me, easy
Okay.
for you. That's one thing. Other thing is, I liked your role play. I like your confidence. I like your language. I liked your grammar. I liked your information and knowledge you have given throughout the role play. It was really very good.
Mhm.
Now,
Thank you, doctor. Yeah.
no problem. Now, I like the way you give the options, including microabrasion, and then also resin filtration. And how did you manage the whitening part very smartly? I love this one. Okay.
Okay.
Now, will you ask me a few questions? I always consider part two exam as in part one exam.
Mm.
It's like MCQs for me. MCQs. There are multiple options A, B, and C, and D. Only one option is the correct option. I
Mm.
consider part two this way as well. How? When you ask me a question, I'm thinking about the scenario this way. If the scenario is patient has fluorosis,
Mm.
right? What
Yeah.
is the question? What is the best question you may need to ask this patient? Okay. The
Mm.
question you ask me is, am I residing in Australia or am I
Mm.
traveling overseas? How this can help in this case? In Australia, still we have rural areas in Australia. They are drinking only the tank water, and they need to get fluoride tablets in the past, not anymore now. Do you get my point? Now we
Okay.
stop the fluoride tablets, fluoride pills, and then we start to, if I were, okay,
Mhm.
um, rural dentist, and then
Mm.
work in a place that there is no town water, because town water means has fluoride in it. Okay. In
Mm.
this case, I would suggest the patient or the child to drink a bottled water with fluoride in it, for example. Okay. So
Mhm.
now, do we have areas in Australia still does not have fluoride? Yes. Doesn't have town water? Yes. So now, to ask a question which is somehow, I believe, it is not related to the scenario or doesn't make any benefit in the scenario, I would say it's better to ask this question. Do you get my
Okay.
point?
Okay. Yeah.
Especially, I give you the history of fluoride pills, fluoride tablet.
Yes.
So please,
Yeah.
one, don't ask any question which is not related to the case or actually will not add important
Mhm.
information in the scenario.
Okay.
Okay? And try to make things easy, because I may confuse you. I may even take you toward Kenya now. I may tell you, yes, I traveled to Kenya, and in Kenya, I have done this and this and that, and then take you to Kenya. You will forget about this, the bold part, and we both will
Yes.
talk about Nairobi as a capital there.
Yes.
Do you get my point?
Yes, doctor.
Yes. So be all specific in the point. This one. So you have asked this question. I believe even one more question like this way. Now, at the end, when we been this, because now we can discuss about the consent part. Okay.
Yeah.
At the end, when we talk about the consent part, actually, what has happened is, I told you, you said we can send them an email, right?
Yeah.
I said they actually don't use any. They don't use. They don't have an email system. They don't use an email, but they may have phone.
Oh, yeah.
Did you get my
That's
point?
true. Yes.
Yes. Okay. Phone then. I will phone them. That is a good option still. Phone is okay. Even with phone, as long as you're gonna talk with the phone and verbal consent, it works fine. No problem.
Okay.
You talk on the phone, and then this happened, and then you write down you spoke to the phone, and that's it. Now,
Okay.
what about, think about right now,
Mm-hmm.
what about if the patient, he is living alone, dependent, doesn't talk to the dead, doesn't want any one of them, he is paying by himself, he doesn't want to talk, he said like, I don't want to talk to the dead, I'm not talking to the dead. Now, legally, can we really, they really sign for themselves or not? Sorry, am I audible?
Yes, doctor. Yes.
Can they really sign for themselves or not? Now, we have some conditions here. We have a law, it's called minority law in Australia. The minority law is, if the child is a 14-year-old, they can consent for themselves if they understand the treatment, they understand the risk and benefits, they understand the alternatives, they understand the consequences of treatment or no treatment, if they can reason and make a voluntary decision themselves. What about elective type of treatment, or cosmetic treatment, or a reversible procedure? These are three things here right now. One, elective treatment. Two, cosmetic, like this condition we have right now. Three, a reversible procedure. Right? One, I will encourage parental involvement. I will be cautious. I will document the capacity carefully. Is it legally allowed? Yes. Is it it is always the best practice? No. What does it mean? The answer is still yes. He can provide their own
Consent.
consent. However, I will encourage to get the parent first.
Okay.
But if he just said, no, I don't want, no, I'm telling you no. In this case, I ensure he understood. I tell him, look, do you understand? Yes, I understand. This is as cosmetic treatment. So I really need the parents in this. No, but I will not involve them at all. No. And they insist him. Do you understand the risk and benefit? Yes. Do you understand the alternative? Yes. Do you can provide, make voluntary decision? Yes. Okay. In this case, I will accept it.
Okay.
But try in the beginning to get the parents to encourage the parent involvement. Did you get the whole scenario? Again, is it
Yes.
legally allowed? Yes. Is it the best? Is it always the best practice? No. Okay.
Yeah.
Now, there is one thing here right now at the end. I want you somehow to work it out. Okay. One, I don't want you to lose your confidence. Okay. Think this way. In a practice, as long as you agree to treat the patient or you agree to see the patient, means you are the boss now. There is no boss in the practice except you.
Okay.
What does it mean? Don't tell the
I don't.
examiner, don't tell
Yeah.
anyone. I will
Hmm.
discuss with a senior dentist who you are. Sorry, if you're not a dentist, why see me?
Hmm.
Don't say I will discuss with practice manager. You are the
Okay.
boss. Practice manager actually takes money from you. If you're not working in the practice manager will not get money.
Okay.
You are the boss in the practice. You are the one. The patient gonna pay you. If something,
Hmm.
let's say, if the practice managers, let's say, do the treatment, let's say, and it
Hmm.
was wrong treatment,
Hmm.
the patient gonna sue who? The practice manager or you?
Me.
So no benefit. Did you get
The
my point?
treating dentist. Yeah. Yeah.
Okay, this is something very important. So now let's learn this today. Point which is very important. One, whitening for a 14-year-old, 15-year-old, 16-year-old, as long as they have permanent teeth. My
Hmm.
suggestion is it's not the best practice still. It can
Yeah.
be done, yes. If it just only one or two teeth max, and
Hmm.
if it's really, really, really required, but not the first option in this case.
Hmm.
What is the first option based on Dr. Cameron, based on standard guidelines, based on AAPD, based on all this stuff? Okay, the best is
Microabrasion.
collaboration in the beginning. You
Yeah.
need to discuss with the child or the 14-year-old or 15-year-old or 16-year-old. You need to discuss with them that microabrasion may be a little bit right,
Hmm.
like that. It is actually still conservative, but it may remove a little bit of tooth structure, which is zero point 0.1 to zero point 0.2. Do you
Hmm.
agree with this? Yes, we can go ahead with it. Okay.
Hmm.
That's microabrasion. The second one is resin filtration. Yes, sometimes we need to camouflage. We need to mask the tooth packet, the tooth itself, and this we're gonna do with a resin material, resin filling. We call it as resin filtration. If and then you have a photo session. Yes. I need to do whatever. Okay, so I need to be done 2 weeks. Okay.
Hmm.
Yes, the things will be based on my experience. The treatment actually will be very productive, and you will be happy with the result. Are you sure? Yes, I'm sure. Why? Because I have experience in this. I have done lots of cases like you. Do you
Okay.
get my point? Be
Yes.
confident about what you say.
Hmm.
This is what we learned today. What else we learned? We learned actually the consent. Can 14-year-old can give consent? Yes. Is a best practice? Not always the best practice. But in some patients they really insist. They want to do the treatment in their own. Right? So in this case, fine. As long as you encourage in the beginning to involve the kids. Sorry, to involve the parents in that.
Hmm.
Did you get my point?
Yes, doctor. Yeah.
Okay, fluorosis. You discussed fluorosis very nicely. You discussed the reason fluorosis very nicely. You said the word ingestion. That's the word I really want to hear it. What else? That's I would say that's mostly everything.
Doctor, I have one doubt.
Yes, please tell me.
So if the patient is like, I'm unhappy, my dad this did this to me, how to address that?
The best way in this is what you did was right, was correct. What you did is you said that most in the past actually, dentists used to prescribe this medicine as was of part of the regulation, the guidelines. And then the most popular, the dad has actually followed the dentist's advice. So he didn't give most likely, use the word most likely, okay?
Mm. Yeah.
Or apparently. Don't
Mhm.
say, don't confirm facts because I don't know what has happened. We just say things we believe, right? So
Yes.
apparently, your dad has given you this medicine or the pills actually based on a dentist suggestion. So he actually wanted you to get the best teeth ever because fluoride actually it strengthens the teeth, made the teeth very strong. And that's the reason
Mhm.
why we used to prescribe that time. However, if you're really still in doubts, I can right now, if you like this, I can talk to your dad, meet him, and I can ask him personally if you want, and then I can explain to you what he told me. If you don't want to talk to him, but if you really want to talk to him, we can both talk together, me and you and the dad, and then we actually find out more what has happened that time. What do you
Mm.
and then ask the patient, how does it sound to you?
Oh, that sounds really good.
Okay, that's the best
Yeah.
way. You haven't said
Yeah.
something wrong. You haven't say any. You haven't assumed anything, right?
Mhm.
You try to sort out problem nicely, and then involve everyone, and then finally the dad definitely gonna say, "No, I love you very much." It was at that time just only the dentist has described these things to you because at that time you had maybe weak teeth, so he had even good intention to help you. Okay.
Mm. Yeah.
Any more question about this part at all, or any doubt?
One more doubt. So this
Yes.
is diagnosis cluster, and we already did the scale and clean.
Yes.
So is it possible that the patient doesn't know our name and we did the treatment? I mean, not the treat, yeah, scale and clean and also examined him. So do
Yeah,
we need to
because
again introduce?
well, okay, it doesn't really be harmful if you tell the patient your name again. Do you think so?
How do we start the case then?
You can say, okay, Mark. Hi, Mark. How we going? Look, we have done skill and clean. And by the way, I have told you my name in the beginning. I am Doctor This, for example, just in case if you
Okay.
want to call me at any time. That's it.
Okay.
It
Yeah.
doesn't harm
Okay.
anything, right? But
Yes.
and the
Yes.
criteria has been mentioned that you need to build up rapport, and the best look, build up rapport is a criteria, not just only information gathering. Build up rapport is actually in every single communication room. Do you get my
Mhm.
point? And
Yes.
definitely, the patient just to see him right now for the first time. So in this case, they
Mhm.
need to know your name still. Look,
Yes.
does it really harm? No.
No.
Can it be really some marks on it? Yes, I will take the marks. If I
Mhm.
say it, will I lose marks? No. Will I look stupid? No. Do you get my point? But
Yes.
what if it is a part of criteria in every single case to say my name? For example,
Mhm.
I got the marks. Look,
Yeah.
with any exam, with ADC exam, you must play safe.
Yes.
Easy?
Yes. Yes.
Very good then. Okay. Any more questions, please?
No.
No? All good now? Everything's fine?
It's all good. All good. The
Okay, I'm
main
very happy.
points I learned is here: be confident and be the
Very
boss
good.
in the. Yeah.
You are the boss.
Yes.
Okay?
Yeah. Thank you, doctor.
No problem. Thank you very much then. Okay, guys, I see you have lots of questions here right now on the Facebook. Um, Dr. Iman mentioned, Dr. Can the bleaching cause more worse appearance in fluorosis? I would say no, because fluorosis opacities. And if you go into Dr. Cameron book, for example, because you like this way, right? You like the tell you where about. If you go to Dr. Cameron book, maybe in the page number, I don't know which page number, I can search right now. Let me search which page number Dr. Cameron. Let me search. Okay. 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 Battery low. That's fine. Yep. I believe that is page number. Is it 100, 200? This one. 340. 340. There is something. There is a word here. There's something called here management of stains and opacities Fluorosis is obesities. Fluorosis case has obesities in it. So the second modalities of treatment is, right, that's peroxide-based bleaching agent. Peroxide-based bleaching agent. Now, can whitening be used in cases of obesities? Yes. Okay, go guys and search more about this, you'll find it. Okay, before even microabrasion this stuff. Okay, doctor, thank you very much, doctor. That was great. Thank you very much, doctor. Thank you very much, you guys. Have a great night, every one of you. Thank you very much, you guys. There are lots of questions on Facebook. Please, guys, we can ask this question on Telegram group. Tomorrow we going to have our session for part 1, and the mock exam will be decided by tomorrow as well. Thank you very much, you guys. Which day gonna be? Thank you very much. Have a great night, everyone. Thank you.